Assalamu alaikum everyone, we are here again together. Our Central Asian Medical University presents you quite exciting and useful information for you. Our department is Department of Pathology, Basics of Pathology, and I am assistant of this department. My name is Simkoran, and our today's lesson will be the what's to the acid balance continues. In our previous lesson we talked about so many useful information, and I will give you a remaining informations. And the second one is cell injury, and third one is dystrophies, and the last one is adaptations. I hope and I believe that our today's lesson will be useful for you in your future profession. Look at that. As metabolic alkalosis, we have talked about that. Metabolic alkalosis is caused by losing the hydrogen ion from our organism by several reasons. First of all, look at the prolonged vomiting. Vomiting means that when we vomit, we discharge the fluid of the stomach out. Okay, the stomach is full of these hydrogen ions because hydrochloric acid located there for digesting the proteins. It's necessary, and when we vomit again and again, we lose the hydrogen ion, and for maintaining the normal hydrogen in the stomach takes the hydrogen from the bloodstream. As a result, the amount of hydrogen in the bloodstream will decrease, and the patient may suffer from the alkalosis. Okay, in this kind of situation, we can help the patient by infusion intravenously the sodium chloride. That's enough. And the second one is hypovolemia, and the third one is diuretic use. Diuretic use means that when we use diuretics, so many diuretics have to discharge the sodium, potassium, and the hydrogen from the kidneys for increasing the amount of urine in the organism. And when we use the loop diuretics or the thiazide diuretics, we have to lose the hydrogen ion. Okay, so we always pay more attention to the patients as a metabolic alkalosis when we use the diuretics. Okay, and the next one is hyperkalemia. Hyperkalemia means that don't forget that the potassium and the hydrogen ion go together. When we lose the potassium, we will lose the hydrogen. Okay, and when you measure the potassium from bloodstream, and if you analyze that the amount is not normal, you should think that there is some kind of metabolic alkalosis occurring. Okay, now, and the kidney's role in maintaining the acid-base balance. Look at that. The kidney have so many functions, and one of the most important is the normalizing, stabilizing the acid-base balance. Okay, the hydrogen ion and the hydrocarbonate ion. Hydrocarbonate ion is necessary for the base. Hydrogen ion is for the acid. Look at that. If the patient have acidosis, the kidney try to reabsorb hydrogen to the bloodstream and try to excrete hydrogen to the urine. Okay, by this way the kidney will decrease the amount of hydrogen in the bloodstream. If the patient suffers from some kind of base, and I mean that the alkalosis, the kidney try to excrete hydrocarbon into the urine and try to absorb the hydrogen to the bloodstream. By this way, the kidney can maintain the normal acid-base balance. Okay, now look at that. That's a cell injury. That's a normal cell. Normal cell. Look at that. A normal cell have its normal organelles. For example, you can find out that lysosomes, Golgi complexes, nucleuses, and some kind of mitochondria that's necessary for the energy. If the injury occur, for example, the oxygen deprivation occur, it means that the patient's normal cell have to compensate according to the oxygen deprivation. When there is not normal amount of oxygen, the cell has to use another type of energy. The oxygen is necessary for the citric acid cycle. If there is not normal amount of oxygen in the bloodstream in the cell, the citric cycle couldn't perform it normally, and the cell adapt to get energy by glycolysis. For glycolysis there is not a necessity for the oxygen, and according to the glycolysis, lactic acid in the bloodstream will increase in the cells. Lactic acid that's an acid. Its function is denaturating the proteins. When the lactic acid's amount increased until the amount of high level, the cell tried to stop the glycolysis. Glycolysis stopped, and it means that there is not any ATP in the cell. ATP's main function is maintaining the energy for the sodium potassium channel. Sodium potassium channel is keeping the normal amount of sodium outside and potassium inside, and its main function is taking out the sodium into the cell out of the cell and taking the potassium to the cell. Okay, by this way the cell keep the normal function. Okay, and there is no any oxygen, there is no any oxygen, and there is no any ATP, and there is no any ATP energy for keeping the sodium potassium channel. It means that the sodium will have to be in the cell, and the sodium always tries to be together with the water, and water is inserted to the cell, and the cell swell. Okay, this swelling is reversible injury. It means that when we get the oxygen to the cell again, and the cell try to normalize its function by using this potassium sodium channel, and the cell become normal cell again. That's a reversible injury. But and the oxygen deprivation will continue, and the reversible injury will change it to the irreversible injury. It's a necrosis of the cell. The net result is there is no any normal cell in our organism. Look at that. And if the swelling continue, there is some kind of dysfunction of the other organs. First of all, lysosomal ferments try to destroy the Golgi complexes. Look at that. And the next one is mitochondria. Mitochondria is necessary for the energy. And the last one, the karyopyknosis, karyolysis. That's destruction of the nucleus of the cell. Okay, and the last thing may occur in the patient's cell is destruction of the nucleus. If destruction of the nucleus occur, the nucleus couldn't become normal cell again, and it have to necrosis. Okay, when the pathoanatomist shows the cell's condition by dyeing it, and when they see under the microscope, they can find out that if there's a loss of a nucleus, it means that there is some kind of necrosis. Okay, and our next information is dystrophies. I'm going to say that the dystrophies is a common term in the medicine. Dystrophy means that there is not a normal trophy, and there is not normal trophies of the cell, and I'm going to show you the clinical sign, and I'm going to describe dystrophy by the muscular dystrophy. That's a Duchenne muscular dystrophy. In the Duchenne muscular dystrophy, the dystrophin protein will accumulate in the muscles, and it impinge on the normal function and the structure of the actin myosin. When it accumulated in the muscle cells, it try to compress the normal actin and myosin, and the result is they will be damaged. Okay, look at that. That's the clinical symptoms of Duchenne muscular dystrophy. The onset year of the patient is between the 4 and the 6-7 years, especially in the boys. Okay, in the patient, progressive muscle weakness and atrophy occur, and especially there's a pseudo hypertrophy of the calf muscles occur, and the patients have suffer from the fatigue. It means that it's very difficult. The patient said that it's difficult for me to do some kind of movements and doing some kind of homeworks. And the patients have to use their toys to walk, and the patients say that I have difficulties climbing up and climbing down from the stairs, and the parents of the patient say that our baby, our dear child is frequently falling, and according to the not normal normal function of the muscles, development delay may occur, and for breathing normally we have to use our rib cage muscles, and rib cage muscles couldn't contract properly. Breathing difficulties may be accurate, and the next information is learning differences. Some kind of learning difficulties may occur in the patients according to the abnormal function of the muscles, scoliosis. Okay, this is S-shaped spinal column may occur, and the patient suffer from the speech delay and language development, and the patients often not long enough, and their stage is very short. Okay, that's a function. That's a clinical signs of the Duchenne muscle dystrophy. Our next information is adaptation. That's how the cell. Look at the how the cell and normal amount and normal volume, and when the cell hypertrophy, its volume will increase. Look at that. Look at that. That's normal size, approximately 1 centimeters, but it's 2 centimeters. Okay, and hypertrophy occurs physiologically, pathologically. In the physiology, for example, when you excite your skeletal muscles, hypertrophy, and when you have some kind of heart wall defects, your myocardial cells will hypertrophy. That's a pathological hypertrophy. So hyperplasia means that the increasing number increase. Okay, that's a 5. Okay, hyperplasia may occur due to some kind of several reasons. For example, Barrett esophagus, when you suffer from the frequent gastroesophageal reflux disease, and the layer of the epithelium of our esophagus will change. It is count, and it will become hyperplasia. And you can find out the the hypertrophied heart, and that's a normal heart. And if you can see there, the size of the wall of the cardiac muscles will be enlarged. That's pathological process also. Thanks for watching, and if you have any questions and offers and some kind of complaints, we are always ready to accept you from in your comment section of your YouTube channel. Thanks for watching one more time.